Good afternoon, everybody. It's so nice to see all of you all come in this afternoon for this very essential and important session which we are conducting today, the first time in Thane city, for the doctors. So before we start, I would like to welcome Dr. Mrudula to come and start it with a prayer.
Annam param tejorupam जीवनाय प्रकृतेः वरं यच्छाम्यहं कृतज्ञेन मनसा नित्यं भूता नमाम्यहम्. अर्थात, food is the radiant form of divine energy, a gift of nature for sustaining life. With a grateful heart, I accept it and bow to all beings who made it possible.
Traditionally, we always light the lamp before any function, but as people who love the nature, we would like to water our plant here. So I would request on behalf of WDW, I would request Dr. Jayati ma'am to come. And from the pan, the speakers, Dr. Smriti, Dr. Anuja, Dr. Sharang, please come. So we'll start by watering, and this is the nature which we have to nurture so that we can be healthy. Unless the planet is healthy, we cannot be healthy. So please come here. So once again, to everybody, a very, very warm welcome. Myself, Dr. Lata Ghanshamnani, on behalf of Indian Medical Association Thane branch, and as a committee member of WDW, welcome here y'all for the CME on plant-based diet for lifestyle medicine. Before we start, I just want to share a line, quote, which normally we use. We are what we eat, right? We always say we are what we eat. If you go a little deeper into it, we are what we eat as science, as doctors, as somebody who believes that it has to be evidence-based, then definitely we know it means health. And what if we can make this phrase, we are what we eat, as a tagline for our first-line prescription? Can we make it our first-line therapy for treating patients is what we'll explore today. Because what we always are taught is that things in science have to be backed with facts, have to be backed with some research, which we can advocate and finally practice for our patients. And what we are healers, but more than healers, we should try to prevent any disease coming in. So today, what we are going to concentrate on is how is it that we can prevent from falling sick, how is it that we can stop diet-related deaths, and also look at how our plate respects the planet. So with that note, I would like to introduce you all to PAN. PAN stands for Physicians Association for Nutrition. It is actually made to educate, empower, and engage through the medical professionals, the community. PAN is a global not-for-profit organization, and this organization is now bridging gaps between the education part which we have missed in terms of nutrition. All of us here are basically MBBS followed by a specialization, but we know that we little do know about what is nutrition, right? So here, that knowledge is what is going to come into place, and we are going to look at how we can work globally to address this problem. So PAN has centers, 10 of them all over the globe, with its headquarters in Germany. In fact, PAN has a presence all over India. And what is PAN? So when I said PAN is about education, empower, and engaging. So education means training our physicians, our doctor community, about what is the missing link between health and nutrition. Second, creating tools or resources which can help us propagate this information. Not all of us are enabled enough to go back to books, read up, and know what is B12, how is it absorbed, or for the matter vitamin D or anything for that matter. It is too late for us to get into nitty-gritty. What if we are given a handheld tool which simplifies our executional skills in trying to prescribe our first-line treatment for diet? That is what they are building. So PAN is engaging in getting all the evidence base on nutrition on one platform for all of us to access and use them in practical approach towards our patient. Besides that, it is not only just working in trying to build a community of doctors who know this, but also at a policy level, it's engaging with the government to see how it can be gotten into the system of Ayushman Bharat, where we are talking about preventive and lifestyle, medicine. There also they are trying to influence on. Plus, they are catching the youth, that is the budding MBBS students in the colleges, medical colleges, also for this concept. So looking into policy advising, industry guidance is all part of PAN's engagement. Like I mentioned, lot of research, lot of evidence-based things are going on, and we are doing this at almost every month, regular basis all over the country. And now we are very happy to say that we have chapters of cities. Before I go and introduce you the chapter heads, let me talk to you about what are the global heads of PAN. So we have Dr. Alan, Mrs. Kristen, Parag Agarwal, Deepak, Rinki, Dr. Regina, who's leading this at a big note for the entire community of PAN. We have a scientific and medical advisory council members. You could go through the website to see the details of these people, the executional team, the research and content team, and this is the spread of PAN currently in 2023-24. There are recurrent happening webinars, journal clubs, and discussion forum for this subject. We have currently 3 chapters, Mumbai, Bangalore, and Hyderabad. When we talk about the Mumbai chapter, we have the chairperson, Dr. Rupa Shah, and the board of directors, which we have our own Thanekar, Dr. Sharang Wartikar, and the others. So how can you get engaged with PAN? Yes, you can become a PAN ambassador, you can become a PAN consultant, PAN volunteer, network facilitator, or connect with the students. So there are multiple ways where you can engage. After the session is done, you can reach out to one of us and we will guide you through. So thank you. This is the introduction about PAN. Shortly, we will start the introduction of the speakers today, and then we will have a FAQs and cooking demo. So to just in the interest of time, so that we have more time on discussion, I would like to introduce our first speaker for the day, Dr. Smriti. Dr. Smriti is a dermatologist. So she's trained as a dermatologist for the last 5.5 years. She's practicing lifestyle medicine in dermatology. She has so much of ground experience in using diet changes to heal dermat-related issues. She's pediatric specialist, and she has also done a diplomat from the University for Lifestyle Medicine in US. So I think all in all, she is a package. She practices in Fortis Mulund, so very across the city, and she is going to be shortly speaking. I would invite Dr. Smriti to come over and start with the first session on lifestyle medicine.
Thanks a lot, Dr. Lata, for such a warm welcome. Good afternoon, everyone. As Alvin Toffler has rightly said, that the need of the hour in 21st century is to learn, unlearn, and relearn. We all have learned the way of conventional medicine for our specialities, and now it is time to unlearn and relearn a new methodology of conventional medicine where the whole human takes the center stage, where we stop looking only at the part of the disease, the human structure which is diseased, and just prescribe him or her the medicines, but start looking at the root cause. We are very fortunate that today we have strong, robust studies and now a specialty which has come up as lifestyle medicine. A lot of us wonder what it is, how it is different from what we are already telling. So here I am to discuss about lifestyle medicine and its importance. We have seen that since 2000, the data of global deaths is changing. The demographic is changing from communicable diseases to non-communicable diseases. India is the diabetic capital of the world. They say that now we have so many diabetics that soon probably will not have enough rooms in the hospitals to handle them. So why not to start with primary, secondary, as well as tertiary prevention? Across age groups it is coming. We are seeing 6 years of people, with diabetes. It's not an old age disease anymore. And not only that, the states across India are spending lots of amount of their GDP on NCDs. Cancer is going to rise by 57.5% by 2040, and CVD is the topmost mortality causer for all of us. And there is a specific thing about Indians and their geneticity. Indians are predisposed to diabetes at early age and lower BMI. So at 23, we are a normal BMI, but 25, we become overweight, and beyond 25, we are already obese. And we have the central adiposity, which makes us so prone to diabetes. Besides that, we are more prone to the coronary artery disease and alcohol dependence. So genetically, we are doomed. If we start living the way the Westerns are, the rich and affluent class diseases of this lifestyle diseases, we are got to get them earlier. So, are we doomed? Well, till now, everybody told us, अगर आपके पापा या मम्मी को diabetes है तो आपको होगा. आपको thyroid है तो आपको होगा. अगर आपके घर में किसी को हार्ट डिजीज है तो भाई ऐसा है, एंजॉय कर लो अपनी लाइफ को, क्योंकि वो होना ही है. एंड यू विल बी विद मेडिसिन फॉर लाइफ. बट देन people started understanding what is epigenetics. Earlier, we used to call them junk genes. They're like 99% of our genes being junk genes. Really? Thankfully, now the studies are coming on these epigenomes. So all of the environmental cues, whether it is your nutrition, your stress, your toxicants, your air pollutants, and the pathogens, they don't work on the genetic structure, they work on the epigenes. And when this interplay happens, that is when the phenotypic change happens. So there is one modality where we start working on the genome, we go for the stem cells and this, and that will also work, that is also important. But also what is more important is to understand that these epigenes are not the junk genes. Dr. Esselstyn talks about it
very, very good way. He says, genetics load the gun. Lifestyle pulls the trigger. You can have a loaded gun for life. And believe me, this is such a heartening sentence. You can have a loaded gun for life. You still do not need to manifest it. There was a beautiful study that happened in US wherein they were finding out what's actually the cause of the deaths in US in 1990. And they found out that out of 50% of those deaths, 40% were happening because of the behavioral choices that we as humans were making. The first was tobacco. Believe me, today they repeated it in 2017. The poor diet and physical inactivity became number 1 and tobacco number 2. The third is alcohol consumption and fourth is illicit drug use. So, is lifestyle medicine different from the conventional medicine? No.
As a matter of fact, it is the foundation of conventional medicine. It's just that our prescription now does not start with the medications. It starts with the changes of the lifestyle, and the medications become the support system across the clinical specialties for our own clinical specialty, whether it is dermatology, endocrinology, cardiac, or ortho or surgery or anything for that matter. So lifestyle medicine becomes the primary modality of treatment for chronic diseases. It applies an evidence-based whole person perspective. Good thing is it's not only prevention, it's not a health checkup thing that we are talking about, it's also treating and even reversing the conditions, addressing the root cause of the disease. These are the pillars of the lifestyle medicine which we prescribe to our patients. Nutrition, exercise, sleep, stress, substance abuse, and healthy relationships. I'll be quickly dealing with all of them one by one so that we all have an understanding what a lifestyle prescription means. Now, this lifestyle medicine and all this hypothesis, pathophysiology of our long question is now done. That we believe that there is something like that we have to do it. But we are evidence-based doctors. We have to prove it on ground and not only in our pathophysiology labs. So Dr. Dean Ornish was one of the pioneers since 1978. He's a cardiologist in US, and he has been working on figuring it out if he has an answer beyond CABG and angioplasty for his patients who want. His work is being published in Reversing Heart Disease, and since last 20 years, Ornish diet is topping the charts of the top 10 diets of United States, to the tune that his lifestyle interventions have now come under insurance scheme in the United States of America. So the lifestyle heart trial in 1990, what he did was tremendous. It was a prospective RCT, the Makkah and Medina for all our controlled trials. He got patients with 1, 2, or 3 vessel diseases. Half of them were put in the standard care recommended by AHA, and half of them underwent something called as ITLI, intervention, intensive therapeutic lifestyle intervention. What he did different was that in ITLI, he put all of those 6 pillars of lifestyle medicine. He put them on 10% fat, whole food, vegetarian diet with aerobic exercises, stress management training, smoking cessation, and group psychosocial support. These patients were not having any MI, and they were not planned for CABG. They were monitored for 1 to 5 years. In the standard care group, as expected, the average stenosis increased from the baseline 43.3% to 51.9% with 27.7% relative worsening. But what he found out in ITLI group was amazing. And that was the average percent stenosis decreased. It decreased from the baseline 40.7%, continued to decrease from 1 year and then beyond to 5 years. There was a 7.9% relative improvement. These lifestyle heart trial was done by Dr. Dean Ornish, but that was not the one. In last 50, 60, 70 years, robust methodology with long-term follow-ups, nurses program, Harvard professional studies, Predimed trial, Lions heart trial. In our own India, Sarathi is done for young Asian diabetics, and Freedom from Diabetes by Dr. Pramod Tripathi. The data is just mounting. These are the pioneers of bringing lifestyle medicine to the world, and all of them first followed the lifestyle medicine changes into them and in their own family members. And when they start seeing the changes, being the doctors and the caregivers, we are the builders of health of the nation. It's very difficult when you see the changes in yourself to not tell your loved ones, to not tell your patients. Dr. Neil Bernard of Physician Committee of Responsible Medicine, Dr. Colin Campbell China study brought the word whole food plant-based. Nurses Health Study, Dr. Brooke Goldner reversed her own systemic lupus erythematosus, and she works on autoimmune diseases. Dr. Jenkins brought the portfolio diet for dyslipidemia. And now it has become a curriculum in many universities. Myself and Dr. Anuja, our second speaker, we are diplomate of International Board of Lifestyle Medicine. We have done our diplomate from ACLM, the American College. CMC Vellore has started it last year, and AIMS Nagpur has started the lifestyle medicine course this year. This year only, IISc Bangalore has announced a course with Tufts University. So, why should we as doctors practice lifestyle medicine? That comes in our thought. See, we have to bite a bitter pill that 20% of us are obese, 53% of us are obese, and every 4th one of us is hypertensive. Plus, the way that we treat the patients today, we have an immense burnout. See, we are humans. We do not feel nice when we tell the people and the relatives that, you know, your relative is not doing very well, especially the ICU. It's a difficult thing for us to say. To the tune that in 2020, during the COVID era, 69% felt depression and 13% had thought of suicide. So these 6 pillars can help us reduce this burnout. Our own health improves. It's proven now that the surgeons who regularly exercise have less burnout, who spend the times with their families, and who have a proper circadian rhythm, their sleep disturbances are not there, the burnout decreases. And those doctors which prescribe the lifestyle medicine in their own specialty, 90% have reported to have positive impact with professional satisfaction. You feel like going to those people. They come to you saying, oh my God, ma'am, I have this disease for 7 years. You are my last resort. I really do not want to go to any doctor anymore. And he said, bring it on. I will figure out your root cause. I will work on your 6 pillars, and we together will build a better health for you. So doctors are also role models for their patients. This is not something that is being told. It is also evidence-based. When we practice what we preach, it says that the physicians who exercise are more likely to counsel others for exercising. With those with normal BMI are more confident about their counseling. Those who eat less fat are more likely to record cholesterol of their patients. Those who eat fruits and vegetables every day are more likely to counsel the nutrition, and the patients are also going to listen to you more. So this is one Dr. Davis Sabgir of Ohio. He wanted to bring about a change in Ohio as a cardiologist. And then he started something called as Walk with the Doc. He wanted his cardio patients to walk. How beautiful it's an exercise for the cardio patients. And then he started consulting while walking with them. And now it has become a rage in Ohio. Walk with the doc. Walk the talk, dear doc. And this is when we post in the social media, we do not realize it, but patients are listening. They are watching us, and they are observing, and they are getting motivated. So the first pillar of lifestyle is nutrition. The details about the nutrition Dr. Anuja will be telling you about, but I'll just tell you one thing. When this study in Lancet was published in 2017 on what are the global deaths attributed to the diet, they figured out that one of the important factors, which we always say was high processed meat, and we say mutton mat khao, high processed meat is bad, but it was quite lower rung in that hierarchy. Then came the high sugar drinks and high trans fats. These are our processed and packaged foods quota. And this is, you know what, this is where we all stop. We tell them not to eat too much meat and stop the packaged foods. But then what we do not talk about is the ones above. And could you see that 7 out of 9 of them, whether it is less whole grains, less fruits, less nuts and seeds, less vegetables, less fiber. The most deficient nutrient today is fiber, not vitamin D or B12, and tufa and legumes. 7 out of 9 of them are whole plants. Our plates do not look like plants, whole plants anymore. They are anything but plants. So the second pillar of lifestyle is exercise. Do you know how many of us do not fall into the category of optimum exercise? Anyone? How many? 90%. Okay, we are not that bad. But 25% of adults are not meeting the guidelines. My problem is 75% of the adolescents are not meeting the guidelines. What is our future going into? I really am worried. 78% of us do not. And you know what? As we grow in the economy, we increase in our inactivity. That's why it's a rich man disease. These are some of the athletes. So the people say, protein kahan se aayega? People talk about all these things. These are all athletes which are shifting to the plant-based because of the longevity. They are fighting their sports with 20 years younger kids, and they are winning over them. And the quick recovery is such that they really do not want to go back. The third pillar is of sleep. Many a times we see there, I'm a dermatologist, so I always tell people, you come to me for dark circles and you're not sleeping well, my creams are not going to work for you. I will give you creams, but not without a sleep advice. What's very, very important is to understand the melatonin and the cortisol. Nowadays, everybody says, मैं 8 घंटे सोता हूँ, 1 से 9 सोता हूँ, 2 से 10 सोता हूँ, रात भर जागता हूँ. You are doing it wrong. Because circadian rhythm is based on sunrise and sunset. The melatonin starts secreting at 10, and the blue light of our technology prevents that. Mobile देख के सोते हैं, Netflix देख के सोते हैं, melatonin does not get secreted. We do not get melatonin there at night. And in the morning, the steroid secretes. Now imagine if we have a night routines. At night, the steroid secretes. Steroid is fight, flight, fright hormone, the adrenaline rush hormone. Where will the repair happen? Where will the inflammation and the chronic inflammatory cytokine decrease? It does not happen because of the circadian rhythm being wrong. Also, one very important aspect of circadian rhythm for which Mr. Yoshinori Oshumi got the Nobel Prize was intermittent fasting. The fast thing that's coming out about intermittent fasting, it really works. But now the data is proving that it works when it is matched with the circadian rhythm. So 6 p.m. dinner and 10 a.m. breakfast of 16 hours fasting will work better than say you are having dinner at 1 at night and then you skip your breakfast when you are really cranky in your office. So this is what about intermittent fasting. The next pillar is of emotional stress, mental stress and spiritual health also going for a toss. Dr. King Lee is a physician from Japan. He worked on something called as Shinrin Yoku or forest bathing. He realized that the phytoncides or the chemicals that are liberated by the trees of the forest, when he put them essential oils in the ICU, the sister said that yes, I can handle the difficult situations. Earlier they were saying 13% only. No, my energy levels are really dripping. I feel very, very stressed seeing all those sick patients. And you put in the chemicals of the phytoncides and they suddenly start feeling good about it. So going to walk in a gym or a parking space works. But it works better if we go to our forests and our farms and get our oxygen there. So I tell patients, stop going to the malls in the weekends and go to those farms. If we really increase their economy, probably we'll be able to save our forests too. And then good food, good mood. 90% of the neurotransmitters are secreted by gut bacteria. The serotonin, the most given tablet that we give. Nowadays, we are giving melatonin tablet also at night for the sleep and for the anxiety. All we need to give is food to those gut bacteria. That rainbow diet picture that you are seeing, if that is how your plate looks like, you will be calmer every day in front of the exams, in front of difficult patients, or the professional things that you are going ahead. This is my case. This is WTW, so why not to present a case of a lady who had oral pemphigus, and her pemphigus never goes without rituximab. She had steroids will never work on her, and believe me, those who have oral pemphigus with ulcers around there, they just do not want to live. Believe me. Now in this case, her pemphigus wasn't a remission. She came to me, she told me that it has come up, and besides rituximab, nothing works. We tested her for IGRA, the latent TB came positive, we could not give her rituximab, and steroids were never worked on her. I took her history of the lifestyle medicine. I found out that 1 month before that, her child was diagnosed as autism. And that's when she bore the brunt of the mental stress of raising a kid now diagnosed as autism. And her husband is a working person. He had to do it. This started coming up. So I started counseling her for the mental aspect. Beauty is that in autism also, gluten-free, casein-free diet works. So I started working on her diet. I started working on emotional stress, journaling, meditation, tapping, everything was given. I started her on steroid. For the first time in her life, the steroids worked. Not only did they work, in few months we stopped it, and since 1 year we have not restarted it. The next is the substance abuse. We know about smoking, alcohol, drugs. What we also have to start talking about digital addiction. The problematic social media use is causing 44% of adults into depression, and the hashtag sleepy teens, the nighttime specific usage, leads to anxiety, depression, and low self-esteem. So dear parents, if you have teenagers or early youth around, look at them. What are they doing at night? It's very important for us to start talking to them. They are going into addiction. They are going into gambling. And next is the addiction of the whites and the refines and the ultra-processed. This is not for the young. In this study of Michigan, 50 to 80 years of age, 44% were addicted to it. I want to talk a bit about the processed foods. So what is whole? Dr. Anuja will tell what is processed. We all as doctors should also know. Processed is something where something beneficial is removed and something not beneficial is added. ANOVA classification was done by Dr. Monteiro of Brazil, because Brazil was seeing so much of processed foods. The group 1 is minimally processed, like हमने गेहूं का आटा बना दिया. Group 2 is some oils that we add, but group 4 is the ultra processed, which is the problem of today. How are fruits processed? There are 3 or 4 processes. One is thermal processing. Now you see, आलू को बहुत हम बुरा बोलते हैं, potato मत खाओ, but imagine the potato has only 76 calories. When you make into French fries, it goes into 286 calories, and then those chips which no one can eat just one, it goes to 545 calories. You know how much do you take to burn this 545 calories? 1.5 hours of fast walk. Who does 1.5 hours of fast walk after eating this much? And just this much. Then comes the mechanical processing. हम juices पीते हैं. This fruit juice, that fruit juice, the real without sugar. The orange is having 3 gram fiber. The orange juice has 0 gram fiber. The 12 gram of fruit sugar becomes 25 gram of fruit sugar because the fiber is gone. And see the rise in the sugar. And then bichara orange becomes the culprit for the diabetes to increase. Fruit mat khao. Every diabetic is told, fruit mat khao. The problem is there, we do not go into the details ki tum juice kitna pee rahe ho. There's another thing that is coming with the chemical processing. This kinds of colas and things we should avoid. Physiochemical processing is like this, the typical noodle, right? Firstly is physio. आपने गेहूं का आटा किया, आटा का मैदा किया, सब निकाल दिया. Then there is a chemical with so many things. So the day that you allow yourself that noodle, remember all those chemical names which you do not remember from your chemistry classes that you are also getting into it, and then your gut has to process it as chemical or foreign body, and then we say, why are we getting autoimmune diseases? So dangers of ultra processed foods, not only the refined carbohydrates, excessive sodium, bad for the hypertension, trans fatty acids, and then the high temperature cooking, and then these additives. What's the problem with these additives? Those numbers we never remember. These numbers are the mind games. They cause the addiction, and believe me, it is real. आप घर में आलू के फ्राइज करा के बच्चे को खिला दो, वो 10 में खुश हो जाएगा, पर वो जो पैकेज फूड्स वाला है वो कभी नहीं छोड़ेगा. They not only are addictive, they cause ADHD, autism spectrum, headaches, obesity, plus all these diseases. And then they are calorie dense, but they are nutritionally balanced. Now imagine this many apples. Who has eaten these many apples? But एक मैकिल आलू टिक्की बर्गर तो हम सब खाते हैं. And this is what this photo has to be remembered by one and all. 480 calories looks like this, just 4 tablespoons of oil. 2 banana chips में 40 drops of oils हैं, और इतना तो कोई. I've been a plant-based doctor for last 6 years. मैं भी इतना नहीं खा सकती एक बार में. There are whole plant-based people who say मैं बहुत खाता हूँ. वो कहते तुम खुद भी नहीं खाते, किसी और को भी नहीं खाते कहते. मैं कहता हूँ बहुत खाती हूँ. And this person says मैंने तो कुछ भी नहीं खाया. This is calorie dense. You feel that thing. I mean तो कुछ खाया ही नहीं था. There 2 times coffee with 4 Marie biscuits is equivalent to that much of calorie which no one can eat in one go. But ये टंग क्या करें? So for that, Mrudula is going to help us. You have to change the ingredients, not the taste. You have to just celebrate all the time, not cheat, just switch to healthier ingredients. These are my plates which I cook in my home. The cakes and everything, you can have them bindas without worrying, because there is no maida, no sugar, no butter, no oil, no milk in that. So we shift from these juices to the Nimbu pani, nariyal pani, kokum sharbat, and all these snacks of home like makhanas and chivras instead of those fries. Biological processing is something that we all knew about pickles, right? But there is something called as biological factory, in which you take the corn, and the corn is eaten by the chicken, and then either you eat the chicken or you eat the egg. So what happens is that here you are directly taking the proteins. Remember, the protein is basically the nitrogen added to the CHO is created by the plants while they are standing 24 hours in the sun, not by any animal kingdom. But this corn you are taking on your own, you get the protein, but when you have this, you are getting it via animals. So they're just the middlemen. That is the biological processing that is happening. But what we are also getting is a changed amino acid profile. Amino acids of animals is pro-inflammatory. It's pro-carcinogenic. It's an inflammatory one. While the amino acids of the plants are alkaline, anti-inflammatory. It removes the fiber, adds cholesterol, adds antibiotics, adds hormones, removes the plant benefits, increases saturated fats, changes gut microbiome, and concentrates lots of contaminant. We have read it through the food chain, right? The last pillar of the lifestyle is healthy relationships, very important. Please go through this Netflix documentary on blue zones. They found out these centenarians from California, Italy, Greece, Japan, and Costa Rica. The thing that was common is that evening time, the time with their loved ones. And they also had that 95 to 100% plant-based diet and a lot of time for their purpose, their ikigai. It's also written in our own Gita. In 6th chapter of Atma Sanyam Yog, Yukta Hara Viharasya, Yukta Cheshtasya Karmasu, Yukta Swapnava Bodhasya, Yogo Bhavati Dukhaha. He who is regulated in his habits of eating, sleeping, recreation, and work can mitigate all material pains by the practicing yoga system. These are the books that we all have read and feel so empowered by the lifestyle medicine, and so shall you. Thank you so much.
Smriti, it was an enlightening talk, and I'm sure all of us have got enough of messages to take back home, how we are going to change our diet for not only ourselves but our kids, and for the larger community which we are serving is our patients. I would like to felicitate you for this beautiful talk. I would request Vaishali ma'am, can you just please help us? Our next speaker is Dr. Anuja Pethe. She is a qualified pediatrician working at Nanavati Max Super Hospital. She is incorporated, again, lifestyle medicine for treating her patients. She is also a qualified diplomat from the Lifestyle Medicine College from United Nations. And I would welcome Dr. Anuja. Please build on the thing which Smriti has left us with. Thank you so much.
Am I audible? Yeah. Good afternoon, everyone. So today I'm going to talk on whole food plant-based diet. So Smriti just touched upon it as the first pillar of lifestyle medicine. But it is important to know about it and to also understand as doctors what is the solid evidence behind whole food plant-based. And once we know that, we are more convinced ourselves, we try to implement it slowly on ourselves, find the benefits, and then translate it into our family as well as our patients. So what is whole food plant-based? So whole means anything that comes directly from nature, as it is, without being altered, or maybe minimal alteration that we might do in our kitchens, like chopping or maybe quickly sauteing or steaming. So all fruits, all vegetables are whole. Again, what most of us we use, the grains that we use are not really whole because they are polished. When you polish the grain, the bran and the germ is removed, and what stays back only is the endosperm, which is stripped of all the fiber, vitamins, minerals, a lot of phytonutrients, and hence the white rice that we eat. And most of us have been doing that since ages, since years, is actually nutrition deprived. And the whole grain, the whole unpolished brown rice, or we get unpolished millets these days, or the whole atta, the whole wheat atta, or just the broken wheat, just dalia, is more whole compared to the rice or the other refined rava or maida that we use. So brown rice would look something like that. White rice is this. And it is important for us to know what is beneficial and then to train our minds, because most of us, it has been ingrained since childhood that a food should look a certain way. But unfortunately, we need to look back and go back to our roots. आजीच्या वेळचं आपलं जेवण कसं होतं, हातसडीचा तांदूळ. You know, we need to look back into our roots, and really that brown rice is what we used to eat and what is more nutritious, and we want to come back to it. Again, what is not whole is the entire processed thing. The processed white sugar or even jaggery for that matter, because it does not look like the parent plant it comes from. So sugar and jaggery do not look like sugar cane. Again, the white maida, even rava, supposedly healthy, but not anymore. It's like, it's akin to our maida. Then the chips, the oil. Oil also does not look like the parent oil seed. So that is why oil also comes under processed foods. And of course, the ultra processed foods, which Smriti mentioned, with a host of chemicals, emulsifiers, preservatives, and whatnot. So again, they are definitely not whole. Also, what is not whole food? Plant-based, anything which does not come from a plant. So all the animal products, that is the red meat, the white meat, the fish, the dairy, the eggs, and all the milk products. So the dairy includes milk, cheese, paneer, dahi, chas, even ghee. So all this is not whole food, plant-based. But what is vegetables? Okay, nature has given a host of colorful, brilliant, natural, phytonutrient-rich vegetables. All the fruits, intact, without juicing. All the legumes, we have multiple legumes that if we have one legume every day, we wouldn't repeat in about 2 weeks. But how many of us really include so many legumes in our eating pattern? We should be having legumes every day. Whole grains, a host of them, but as we'll see further, we Indians consume a lot of grain, so we need to reduce the grain proportion, we need to increase our vegetables. Nuts and plant seeds, so all the nuts, almonds, walnut, cashew, pistachio, and your plant seeds, pumpkin seeds, melon seeds, sunflower seeds, all these are very rich in healthy fats, omega-3, as well as fiber, protein, a lot of nutrients. And of course, spices, we are Indians, we need our basic spices to make our food tasty. And certain supplements, B12 and vitamin D, are also included in a whole food plant-based dietary pattern. So what are the advantages of a whole food plant-based eating pattern? It is calorically dilute. So they are not having too many calories, but they have nutrient density. They have a lot of nutrients. And they have a low glycemic load because there is a lot of fiber. And there is a high water content. So you are satisfied, you have a lot of nutrients, but minimal calories. They are very high in antioxidants. So a lot of phytonutrients, all the vitamins, minerals that we get from plants, all these work as antioxidants and help our health. And finally, all these work towards anti-inflammatory effect. So kids, I will say kids because I'm predominantly a pediatrician and working mainly on kids and adolescents. Now slowly started working on adult patients as well for my lifestyle medicine practice. But I see those having a lot of fruits and vegetables, cutting down on ultra-processed foods and reducing dairy products. Paneer and cheese are the main culprits. These kids fall sick less frequently. They have less asthma episodes, the adenoids and the recurrent rhinitis that we see, common cold and frequent viral infections, all of them also reduce. The constipation goes away, there is no anemia, the mood is better. So overall, it's a win-win when we have a whole food plant-based eating pattern. And what are the disadvantages of animal products? They are excessive in saturated fat. And as we all know, we'll see further in a few studies that saturated fat is linked to a host of chronic conditions, cardiovascular conditions especially. Then they also have endotoxins. Now these are released by gram-negative bacteria, predominantly in the meat and dairy products. And these, they contain lipopolysaccharides, and these endotoxins are pro-inflammatory, and they will also increase risk of insulin resistance and other chronic conditions. Animal products will also have pesticides, herbicides, because these are sprayed on the food or the corn and all the soy that is grown for the animal. So they are not going to be given organic food. They are going to be sprayed with these things, and this food the animal consumes, the animal's body will concentrate all these toxins, and when we consume the animal, we are getting these toxins in a much higher concentration. And that is the concept of biomagnification. So it is important to get our nutrition from the plants, which are the primary producers, rather than if we move higher up in the chain, we are going to get more toxins from animal products. Similarly, heavy metals, hormones, and antibiotics are also going to be there because these days the animal products come from animal husbandry. It's a business. So these animals are definitely injected with antibiotics and some of them with hormones. So we get all this free of cost. There's something called TMAO, that is trimethylamine N-oxide. It's a compound naturally present in animal products, and also when we consume meat, our gut bacteria will process the meat to produce this TMAO. And this TMAO is linked with increased all-cause mortality. It will increase the risk of cardiovascular diseases, of hypertension and stroke. There is something called N-glycolyl neuraminic acid. This is also present in meat and other animal products as well as dairy. And this is also pro-carcinogenic as well as going to increase the cardiovascular risk. Heme ion. Heme ion is quickly absorbed. Our body cannot limit the absorption of heme ion. And more so, heme is converted to N-nitroso compounds in our gut, which can damage the gut lining, and it is known to increase the risk of colorectal cancer. Whereas the ion from the animals, plant sources with enough vitamin C, our body is able to regulate the absorption and it will absorb only as much as it needs. So if we have enough iron, it will not absorb much. If we are deficient, it will absorb more iron from the plant foods. But that regulation is lost when we have a lot of heme ion. Then comes heterocyclic amines. These are formed when the meat or animal product or the dairy product is exposed to high temperatures while cooking, especially barbecuing. And these heterocyclic amines are carcinogenic because they cause mutations in the DNA. Then advanced glycation end products, AGEs, these are formed when the lipids and the proteins in the animal products are glycated. And again, these are pro-inflammatory. They will increase aging. They will increase degenerative diseases such as Alzheimer's, dementia, type 2 diabetes also. And all the animals will have pro-oxidants, or they will increase the free oxygen radicals in our body. They will increase inflammation, and the entire state will be a pro-inflammatory state. And all these are the disadvantages of the animal products. More so, we also need to look at the calorie density. So oil, which is a processed food, has a lot of calorie density, and just that small amount of oil is 500 calories. As you come towards the other spectrum, fruits and vegetables are calorically dilute, nutrient dense, so they fill you up, and that 500 calories will completely occupy the stomach space. So we need to choose our foods which are more whole, unprocessed or minimally processed just in our kitchens, and which have a lot of plants so that we have more nutrition and less calories in our eating. But all this is okay, but where's the evidence? So let us look at some evidence which will stress that whole food plant-based eating pattern is very important. This is the hierarchy of evidence. So in the center, we can see the case control studies, the cohort studies, and the randomized control trials. And on the top is the meta-analysis and the clinical practice guidelines. And as we go higher up, the evidence becomes more and more robust. So let us look at certain studies which look at chronic multiple lifestyle conditions. So Nurses Health Study is a prospective cohort study, and they tracked and followed hundreds and thousands of nurses from the United States, from multiple centers, and they tracked them for nutrition and lifestyle factors which affected the incidence of chronic conditions in these nurses. And they found, this is the slide which I'm going to specify only about the eating pattern, because right now we are talking about nutrition. They found that red meat increased the risk of premenopausal breast cancer. Obesity increased the risk of menopausal breast cancer. In fact, obesity increased the risk of everything. In the diet aspect, refined carbs and trans fats increase the risk of coronary heart disease and stroke. Red and processed meat also increased colon cancer risk. Whereas what was found protective was a Mediterranean type of eating. That means it had more fruits and vegetables, more nuts, more whole grains, that is unprocessed grains, as well as green leafy vegetables and a lot of antioxidants. So these were more towards avoiding the chronic conditions mentioned above. Then there is another study called EPIC Oxford study. So they divided the population into 4 arms: meat eaters, fish eaters, vegetarians, that means it included dairy, and the last group was vegans. So vegans means plant-based. And they found that the meat eaters had 10 to 11% of their energy as saturated fat, whereas the plant-based or the vegans had only 5% of their energy as saturated fat. And this plays a very important role because more the saturated fat in our diet, more the risk of chronic conditions. The meat eaters had the highest BMI. They also had the highest risk of type 2 diabetes, pre-diabetes, as well as ischemic heart disease. Whereas the vegans had the lowest risk of diabetes, lowest obesity rates, as well as 12% lower risk of cancer. Incidentally, in this study, they found an increased risk of hemorrhagic stroke, but this is one study which this doesn't correlate in other studies. So we just need more studies to kind of confirm about the hemorrhagic stroke, but the overall ischemic strokes were reduced. Coming to hypertension, cholesterol, and cardiovascular diseases, the DASH diet was evaluated. DASH is dietary approaches to stop hypertension. And this diet was evaluated in a randomized control trial. 3 groups were created. One was the control group who had a standard American diet. The second was a group which had a lot of fruits and vegetables, a lesser percentage of saturated fat compared to the controls. And the combination diet was even lesser saturated fat, just 7%. And they also had fruits, vegetables, and certain micronutrients were also there in the diet. And they found that the combination diet reduced BP better within just 2 weeks compared to the standard diet. And this was independent of any weight loss that the participants had or whether they were doing any exercise or no. And also independent of sodium, because in this study they kept sodium levels the same. But later they found that lesser the sodium, better the effect of the DASH diet. So this is the DASH eating plan which came up because of it. And this shows that you have to eat more of vegetables, fruits and whole grains, beans and nuts. Beans are legumes. And we need to limit fatty meats, full fat dairy, and anything that is pure oil. We also need to limit sugar sweetened beverages and sweets. And when we limit the sodium to 1500 milligrams per day, that is sodium into 2.5 will give us the amount of salt, that is sodium chloride, that we should limit ourselves to. So about 3/4 teaspoon of table salt in the entire day for an adult. That gives a much better BP control compared to 2300 milligrams or even higher. Then there is this Harvard health professionals follow-up where they looked at, it's again a prospective study, and they looked at the nutritional factors on men's health. And they found that limiting sodium in the diet and increasing potassium, where this happens when we cut down on sodium, increase the fruit intake, vegetable intake, there's better cardiovascular health. Obviously, we get more phytoestrogens when we have more of fruits and vegetables. When we have more of whole grains, and when we replace fats with avocado, that also was helpful in reducing cardiovascular risk. A healthy plant-based diet, so healthy means a whole food, minimally processed plant-based diet, is better to reduce the cardiovascular risk. But if the same plant-based diet is unhealthy with a lot of processed plant foods, it is going to increase the risk of the cardiovascular and coronary conditions. Even sugar-sweetened beverages will increase obesity, diabetes, and hypertension, as well as cardiovascular diseases. And when red meat was replaced with plant protein, a 14 to 17% lower risk of coronary heart disease was seen, which is quite substantial. This lifestyle heart trial, Smriti nicely mentioned, Dr. Dean Ornish took people with moderate to severe coronary heart disease without any lipid-lowering medications, and they were put on intensive lifestyle changes. Again, a 10% total fat, not saturated fat, 10% total fat in the entire energy percentage, whole food plant-based eating pattern, along with the other lifestyle pillars. And they found that at 1 year, the coronary diameter increased. At 5 years, it increased further, whereas for standard treatment, it continued to narrow further even up to 5 years. Even the cardiac events were less than half. So cardiac event is a MI or a stroke or any angina episode. So these were less than half in the group following intensive lifestyle modification. Again, Dr. Esselstyn also enrolled his patients into a whole food plant-based eating pattern. He trained them extensively about how to go about it, how to manage the kitchen, and how to manage the eating pattern. And he found that their cholesterol reduced substantially. There were no cardiac events once the patients were enrolled into his whole food plant-based program. And he also showed that the angiograms improved beautifully. Now here we can see the right coronary artery on 60 months, that is 5 years of plant-based diet, it opened up 30%. And on the other side, we can see the left anterior descending artery nicely opening up all along its course on 32 months of plant-based diet. So definitely it doesn't happen overnight, but on consistent plant-based eating pattern, there is an improvement in all the cardiac conditions. Again, this is Omni Heart trial where they looked at the macronutrient in the food. So they had to keep all the calories the same. They based these eating pattern on the DASH diet that we saw, that is lots of fruits and vegetables. And they kept 3 arms. One was the carb-rich arm. To keep the calories same, they had to give 4.6 desserts per day. So when you have too many desserts, that means you are having too many refined carbs. So the carb-rich group was having too many refined carbs. The other 2 groups were protein-rich and unsaturated fat-rich. Not saturated, but unsaturated fat-rich group. And they found that the carb-rich diet showed additional 10-year risk of coronary heart disease. And this was mainly due to the refined carbs. So the whole carbs or the complex carbs which come with the fiber are not going to increase our risk, whereas the refined carbs are going to increase our risk of chronic conditions. So the Omni Heart diet was such that you need to have 1 to 2 servings of fruit. You need to have a lot of vegetables. 2 to 3 servings of vegetables at lunch and dinner. So we need to really increase our vegetable intake. We can have dried fruit and nuts as a snack. We need to have fat-free or low-fat milk or milk products because they were included in the Omni Heart trial. But the key word here is fat-free or low-fat. So again, milk is going to give us a lot of saturated fat. We need to cut it down further. Whole grains are better than refined grains. And obviously, the refined grains are going to increase our chronic condition risk. Again, Dr. McDougall had this 7-day program, which was a residential program, and he gave a low-fat, high complex carbohydrate, whole food plant-based diet to the patients for 7 days. And he monitored the patients for coronary high risk. That is the cholesterol, the BP, as well as the Framingham heart risk, which was calculated based on the lipid and the BP. And he found that the weight in the group, median weight dropped by 1.4 kg. The total cholesterol in just 7 days dropped by 22 mg%. The systolic and diastolic BP both dropped. And the cardiovascular disease risk dropped from 7.5 to 5.5%, which is quite remarkable because the intervention was only done for 7 days. And the intervention was a whole food plant-based eating pattern. So it cut out on all your animal products and your dairy and the processed things as well. Again, this is a Predimed trial where they looked at people who did not have any heart disease but who had a high risk of having a heart disease in the future. So they were either smoking or they either had diabetes, hypertension, a high LDL or a low HDL, or they were obese or overweight or had a family history of premature heart disease. That is heart disease below 50 in men and below 60 in women. So these patients were taken and they were put on a Mediterranean eating pattern with olive oil or Mediterranean eating pattern with nuts. And the third group was just generally asked to reduce fat in their diet. And they found that the cardiovascular events were 30 or 28% less in the people following the Mediterranean diet. So again, Mediterranean diet is a diet rich in fruits, vegetables, nuts, olive oil, and it cuts down on dairy products, red meat, processed meats, and sweets and sugar-sweetened beverages. Coming to some studies which look at obesity. So for obesity, we have the BROAD study. BROAD study was done in New Zealand, and here they did a community-based approach. They put people on a whole food plant-based eating pattern with B12 supplements, and they also were given community support. And the controls were just asked to eat a normal healthy diet. And then they tracked these individuals for body weight as well as lipids. And they found that the BMI reduced by 4.24 versus 0.4 in controls in just 6 months, which was a substantial improvement in the BMI. And the total cholesterol also reduced in that group which followed whole food plant-based eating pattern. So in the multiple studies, we are seeing that the cholesterol improved, the BP improved, the heart risk reduced. Again, Kevin Hall was someone who conducted a lot of metabolic ward studies. Metabolic ward studies means he puts individuals in a hospital as inpatients, and they are given a controlled diet and they are given controlled activity. So it isn't like they can move around and they can exercise as much as they want. Their calorie expenditure is also controlled, and certain tests are run on these individuals to measure the fat percent, the oxygen consumed, and other parameters. He did the first set of experiments in 2015 on obese people, and he gave them one group was given a low-fat diet, the other group was given a low-carb diet, and he switched that after 2 weeks, and he found that the low-fat diet people showed more weight loss. He repeated the same experiment with ultra-processed foods. So one group was given ultra-processed foods, the other was given whole foods, and he compared the caloric intake and found that those who were given ultra-processed foods ad libitum, that means they could eat as much as they wanted, ended up eating 500 calories more and gaining 0.9 kg in 2 weeks. Then a third experiment was done on 20 adults, and they were given a low-fat, high complex carb diet, and the other group was given a carnivorous diet, which was a high-fat, low-carb diet, and he found that the low-fat diet, that is the complex carb, whole food plant-based group, consumed 690 calories less per day as ad libitum because they were satisfied faster. Coming to type 2 diabetes, here we can see that the diabetes prevention program by the National Institute of Diabetes, Digestive and Kidney Diseases, UK, they found that lifestyle interventions which promoted weight loss and regular physical activity was helpful in reversing or preventing the progression of diabetes in people with impaired glucose tolerance, even better than metformin. So a group was put on metformin, another group on lifestyle modifications, and the lifestyle modification group did better, twice as effective as metformin to prevent diabetes. Again, Sarthi et al. From India showed that in young Asian Indian adults with type 2 diabetes, on lifestyle modification, the reversal was much better. The remission rates were as high as 75% at 3 months, and they were maintained up to 2 years. Even Dr. Pramod Tripathi is doing very good work. He's putting all his patients on a whole food plant-based eating pattern along with other lifestyle factors. And he's also shown that if the patient loses more than 15 kg weight, they are more likely to go into remission. And also younger the duration of diabetes, better the remission. We also see that cognition, Alzheimer's and early cognitive impairment improves on a whole food plant-based eating pattern, and Dr. Dean Ornish has just published this in 2024. Then even cancer, again Dr. Ornish has conducted this study on patients with a low-risk prostate cancer, and these patients were given a biopsy before starting the intensive lifestyle therapy, and at the end of 3 months, again a biopsy was repeated, and they found that the gene expression changed. The genes which were promoting cancer were downregulated, and the genes which were protective were upregulated. And also the serum of men with the intensive lifestyle change was 8 times more effective in inhibiting prostate cancer growth. Again, Dr. Campbell has done this extensive landmark study, the China study, and it's a book that all of us must read. And here is a basic, quick summary about it, it mentions that not all proteins are same. So the animal protein, when consumed in presence of other carcinogens which we have even in our environment, such as our pollutants, a lot of other chemicals, is going to promote cancer, whereas the same protein intake when we get through plants is not going to promote cancer. Also, not all carbs are same. We saw that whole complex carbs are protective, whereas refined carbs are not protective. And a whole food plant-based eating pattern is protective against almost all chronic conditions. Again, coming to longevity, the blue zones, we all saw this in Smriti's slide. Please go and see the documentary. Again, they are predominantly whole food plant-based and very, very minimal or no animal products. And to summarize, we know that obesity, hypertension, cardiovascular disease, diabetes, Alzheimer's, as well as cancer, everything will improve on a whole food plant-based eating pattern with lot of grains, but whole grains, legumes, vegetables, fruits, plants, and nut seeds. So it is actually our ultimate health insurance. And we just need to have a plate which is 50% fruits and vegetables, and just 1/4 of it should be grains, and the remaining 1/4 should be legumes, that is our dals and our sprouts. So if we follow this eating pattern, we are sure not just to prevent, but also to better control our chronic conditions. Thank you.
We'll be taking questions for all the three speakers after the last speaker is done. I would request Pranshpe ma'am to please come and felicitate our speaker, Anuja. So as we felicitate her, the third topic which we are going to deal with is current understanding of dairy. So when we were asking people to register the Google form for registration for this particular CME, we had written, what are you currently eating, right? So in that, yeah, please. Thank you, Anuja, for that lovely thing. So many things she spoke about whole food, and shortly after these sessions, we'll be demonstrating on how we can include it in our kitchen. So as I was talking about dairy, people have written vegetarian tick. So when we talk about whole food plant-based diet, vegetarian comes with understanding that milk is also part of vegetarian. But no longer are we talking in the same breath. So today we have Dr. Sharang Wartikar, a vitreoretinal surgeon from Thane. He is going to enlighten us about what is the current understanding we have about dairy and how is it affecting us. So at that note, thank you, Sharang, for this lovely topic, because it's so crucial. As vegetarians, you know, we always link milk also as part of it.
Without the presentation, not a big deal. So my first question to you all is, who gives milk? What if I say a mother gives milk, right? If you look at it, every mother gives milk only after giving birth to a child, isn't it? The definition of milk itself is a fluid secreted by female mammals for the nourishment of their young. That is the definition of milk, isn't it? A cow also doesn't give milk her entire life. Please understand this. I took many years to realize this fact. Okay, she gives milk only after she gives birth to a calf. So the rules are same for her, but what do? We separate the cow and the calf, and what we believe, imagine this, that the entire human species is dependent on that cow for its survival. Isn't it? That is what we are made to believe. In fact, our most unusual creation is drinking milk. Humans are the only mammals who drink milk as adults. Please understand this. It's an infant food and we are drinking, and that too of another species. Not even human milk. Another species, and the best part, or rather the worst part, is that we think it's normal. Nobody, if I tell I'm not drinking milk, it's abnormal. But for somebody who's drinking milk of a cow as an adult, it is considered normal. So unless I look something like this to you, I mean, if it's not my mom, it's not my milk. It's as simple as that, isn't it? So if you think logically, dairy, so if you reason logically, my talk should end here. Isn't it? But I have some more time, so let's go on. If you look at it, the livestock animals, okay, and the cattle are the biggest part of that, utilize land as much as equivalent to 27% of the land, that's entire North and South American continents put together for animal agriculture. The amount of water, 8 times more water is consumed by cattle than humans, 6 times more food is given to the animals. And 130 times more waste is created on this planet by these animals, who are, by the way, artificially brought onto this planet. They are not actually naturally on this planet. We are artificially breeding them. The greenhouse gas emissions from cattle is more than the emissions of all modes of transport put together. And if you look at the milk, okay, dairy milk versus plant-based milk, you will see that the dairy milk utilizes 3 times more, releases 3 times more emissions, causes 10 times more water pollution, uses 13 times more land, and uses 22 times more water as compared to soy milk. So dairy is actually destroying our planet. So even if you think practically, okay, and if you reason logically, these should be enough reasons for us to understand that there is no need to consume dairy. But there is still some time, let's go on. Right? We have been brainwashed. Okay, what are we shown as children? Since schools we are taught, right? Milk, cow gives milk, hen gives egg, isn't it? And these beautiful farms, look at the happy cow, look at the happy farmers, isn't it? But the reality is we take milk. Nobody is there giving us milk happily. We take milk, isn't it? Rampant artificial insemination, injecting oxytocins, separation of calves, and purposeless slaughter of male calves, because males have no role in the dairy industry. We are at a WDW event. So I wanted to show this, the life cycle of a female in the dairy industry. That's all she does. Repeated impregnations, artificial insemination. Every time a child is born, the child is taken away from the mother. Imagine the mental and the physical trauma that mother and the child must be going through repeatedly. And this goes on till she is no longer profitable. Once there is no profit, either she is sent to slaughter or she is left to fend for herself eating garbage on the streets. You will not see any buffaloes, because buffaloes can be legally killed and sent for beef. India is world's #2 beef exporter without having a single beef farm. The entire dairy goes for beef. And this is the biggest irony. We call her our mother. So look at this, even if you think emotionally, what are we doing? Is this even logical? Is this even practical? No, nothing is there. But we are all medical doctors and we want to look at evidence to prove that dairy is not necessary. So let us see, right? What are the reasons for drinking milk? Why do people drink milk? Protein and calcium. Some say it is a superfood, a complete food, right? Calcium for bones, proteins for vegetarians, must for growing children, isn't it? Ayurveda, lot of benefits in Ayurveda. Lubrication of joints can happen because of ghee and stuff. Acidity ke liye acha hai. And we have been drinking milk since ages. Our ancestors used to consume so much. What are you talking about now? Isn't it? These are the things that come to mind. Let us look at each of it now scientifically. Although we don't need to, but let's look at it. Which milk is the best for a baby? Out of these human, cow, goat formula, which one? It is the baby's own mother's milk. Why? Because this milk has been customized over millions of years of evolution. Okay, it is made such that even with gestational age, the content of the milk will change, the frequency, the consistency will change with seasons, with time of the day, and it stays for a necessary period and then stops. Why does it stop? Because the baby can then eat actual food. We don't need to drink milk after a certain time because we are no longer infants. So yes, milk is a complete food but for the respective baby, and it's incomplete for adults if you want the scientific reason, because there's no iron, no vitamin C and no fiber in it. What about calcium, the big thing, right? Without milk, what is going to happen? So the idea of 1000 to 1200 milligrams is now being seriously questioned. Okay, studies from 1960 to 2014 were done in this meta-analysis, found no association between calcium intake and hip fracture risk. In fact, the NHS has now said that standard recommendations may be too high, may do more harm than good. They have reduced the RDA to 700 now. Okay? And please understand, bone health is not just calcium. There are many other things also which are required, like vitamin K. The study showed that dietary vitamin K enhanced the bone mineral density and reduced fractures. Similar benefit was not found with vitamin K supplement. So you have to get it from the foods. And which foods? All greens, no whites here. Okay? Exercise, it stimulates osteoblasts, conserves bones tissue and improves balance. So less chances of fall and fracture. So exercise is important. It increases lumbar spine and femoral neck BMD in older adults. Again, exercise and fitness have a favorable effect on bone mineral density. Calcium more than 500 has little, if any, effect on the bone mineral density. What about vitamin D? Higher vitamin D significantly lowered the risk of stress fractures. Now, vitamin D is fat soluble, right? We all know that. So, what is going to happen if you have excess body fat? The vitamin D is going to go and sit into the fat and not be available in the blood. So, obese people naturally need higher vitamin D. Okay? On the other hand, all research has consistently shown that those on a plant-based diet are having lower BMI, less fat. Okay? So, automatically they need less vitamin D3 as well. What about proteins? It has been shown that doubling of protein intake can cause a 50% increase in urinary calcium excretion, right? And this would lead to bone resorption and osteoporosis. But not just any protein. A high animal to plant protein intake had a higher problems with femoral neck bone loss and hip fracture. And animal proteins decrease the risk of hip fracture in this study, but provided the calcium intake was more than 800. Okay? On the other hand, they increase the risk of fracture if the calcium intake was less than 800. What does this mean? It means that those who are consuming animal proteins need more calcium. So if you are studying a population who is consuming a lot of animal proteins, you will get that their requirements are more because of the animal proteins. Okay. In fact, this survey, 87 surveys across 33 countries, what did it show? Higher your animal protein intake, greater is your risk of fracture. And greater is your vegetable protein intake, lesser is the risk of fracture. Right? What about fruits and vegetables? It has been shown that greater intake is associated with greater bone mineral density and lower osteoporosis risk. Okay, and older Chinese men and women with plant-based diet may in fact have half their calcium requirement. Just 400 milligram was sufficient for them. What does that mean? Those consuming more plant foods need less calcium. Exactly the opposite. Dairy itself, we are talking about what dairy contains, but what about dairy itself? They compared East Africans, okay, who were lactose tolerant, means they could consume more dairy, to West Africans, so same country, okay, who were lactose intolerant, and they found that they had 80% higher risk for those who were consuming more dairy. Look at this graph, higher dairy, higher hip fracture. But why Africa? Look at the world data across 40 countries, same, higher dairy intake, higher hip fracture risk. And each additional glass of milk per day increased the risk by 9%. So what we have seen so far, that the RDA itself is questionable, first of all, because it will depend on what kind of diet you are taking. Plant-based diet reduce the calcium needs, animal proteins increase the calcium needs, vitamin K and vitamin D are also necessary, which are always plant-based diet is beneficial for that, and exercise is the most effective way of increasing bone mineral density. And there are a lot of plant sources. We don't need dairy for calcium. What about proteins, right? Yes, paneer, cheese will have a lot of proteins, 18 to 20 grams in 100 grams, but soy chunks has 52 grams. Mung sprouts will have 32 grams. Lentils will have 25 grams. Peanut butter 23 grams, chickpea 20 grams. If you compare tofu and paneer, protein content is similar, but carbohydrates, there is no fiber in paneer. There are fats are 3 times and calories are 2.5 times more. So don't need dairy also for proteins. You will get it from a whole food plant-based diet. What about children? Have you seen this site? Why are most kids reluctant to drink milk? Why do you have to be forced, and then you put sugar and Horlicks and what all just to get that milk inside their body somehow? It's because 70% of Indians are lactose intolerant. There are all kinds of things. The kids can't express all these things, and we don't even correlate it to the dairy that they are taking. We think something else, some viral and this and that. That is what we keep doing. Our body stops making lactase enzyme after 3 years of age. Why does it do that? Because it assumes that we are intelligent enough to understand that milk is no longer needed and we move on to foods. Okay. It was shown that higher protein intake in infancy and early childhood is convincingly associated with weight gain, right? And especially animal proteins, especially from dairy, is the primary cause. We all know about protein milk allergy, one of the commonest food allergy in infants. Pediatric atopic dermatitis has been linked to dairy. Acne vulgaris has been shown to be linked to dairy. Dietary fibers were studied in type 1 diabetes, okay, and they found that high childhood cow's milk intake may increase the risk of type 1 diabetes. In fact, the immunity to insulin, what is the mechanism, has been suggested to be one of the primary autoimmune mechanisms leading to the destruction of islet cells. And what did they found? That the first immunization to insulin occurs by exposure to bovine insulin found in cow's milk. And breastfeeding, we know, is widely regarded as being protective against type 1 diabetes, but its benefits may be lost if the mother supplements breast milk with cow's milk formula. Children will be better off not taking dairy. Ayurveda. So I am not an Ayurveda expert, but I have a friend, Dr. Nitin Kochar, who studied the scriptures, and he gave me this references by Charak Acharya ji and Bhav Mishra ji, and the gist of this is that even Ayurveda says do not drink milk if calf is less than 1 year old. We understand that because there are so many hormones at that 1 year, or after 1 year even the calf will require less milk. So whatever little is left, they said that is okay. Calf has died early because the stress hormones will increase in the mother. Cow has grazed nicely. If they are not grazed in sunlight, then don't take it. Cow has not received fresh air and clean water, don't take that milk. Cow has been milked in the morning time, then don't take that milk. And if the milk is not fresh and warm. Today, which of this criteria is getting fulfilled? Not a single one is getting fulfilled. We are doing entirely opposite. From day one we are milking the cow, the calf is taken away, a lot of stress, and we are injecting all these hormones. Fake milk is a completely different story, right? There are so many fake milk, just chemicals they are putting and giving us milk, right? But even normal milk, actual cow milk, if you see, is full of contaminants, and many of them which are banned is the indication that are currently used illegally, right? And there are no limits established for them. It's a khula maidan, okay? And pasteurization processes are not efficient to eliminate these contaminants. And what are these contaminants? Not one or two. See this, look at the pathogen. There is every pathogen listed here has 2-3 studies correspondingly where they have shown the presence of these in dairy. Pesticides, look at this. Heavy metals, mycotoxins, antibiotics, hormones. Anybody interested, do go and look into this paper. Even Ayurveda will call such milk as dushit. So what about lubrication of joints? Because of the fats which are present, but these are saturated fats. Paneer and cheese contain a lot of saturated fats. Are they good or bad? There is a lot of debate going on, but look at the advisory by American Heart Association. Taking into consideration the totality of the scientific evidence satisfying rigorous criteria for causality, we conclude strongly, look at the words they have used, that lowering intake of saturated fats and replacing it with unsaturated fats, especially PUFA, will lower the incidence of cardiovascular disease. So very clear thing, saturated fats are not good for the heart, right? And dairy fats are predominantly saturated fats. Replacement of dairy fats is also shown to reduce the risk of cardiovascular disease. Ghee is predominantly saturated fats and has an increasing effect on plasma ApoB and non-HDL cholesterol. So while we are consuming dairy to lubricate these joints, please let us not forget it is going to lead to heart failure. The joints are not going to be of any use. Relief from acidity. They did a study where they gave people with ulcers and normal people a glass of milk, okay, and they found that in all cases the acidity increased. Why? Because milk contains both protein and calcium, and each are stimulants of gastric acid secretion. So this is just a myth. What about drinking milk since ages, isn't it? Well, records show that tribal folks, even at that time, did not consume dairy because they knew it was bad. Okay? It was the luxury drink for the elite. They used to do something different, so they used to drink that. In fact, even till recently, primarily it was used for household consumption only. Okay? And not focused on local breeds. What changed? It was the British who made us change. Okay? They established these large-scale dairy farms mainly for their military forces. And they started selective breeding and artificial insemination, which was never there in our practices before. And they brought tea and coffee, and now we are all addicts. Right? From a family member, the cow became a milk machine, which is what it is used for currently. And even then, when the British left, the milk consumption was still on the lower side. Then came the huge white revolution, the Amul thing. And see the amount of milk consumption which has gone up. Okay? It's a recent change, please understand. It has nothing to do with what our ancestors did. So let's not think about all those. If I asked you, which is the country with the highest milk consumption per capita in the world? India is not even in the top 40. Can you guess the rank now? India is 99. This is per capita. There are so many. India is the largest consumer of dairy in the world. Okay, because there are so many of us. But if you look at per person, the consumption is less. So when we are thinking the ancestors, so our consumption, in spite of having gone so high now, is still 99 in the world. Okay, so just imagine how less our ancestors must have been consuming. So we have seen there is no benefit, but what's the harm, somebody may say, right? So nothing much, except it could actually be killing us. Okay, because it gives us cancer. The insulin-like growth factor is thought to be a risk factor for several types of cancers, and to increase milk production, cows have been bred to produce higher levels of insulin-like growth factor, right? And cow's milk contains substantial amount of branch chain amino acids which increase the plasma concentration of IGF. They also have leucine, which is high in amount, and that stimulates the mTOR pathway, which is responsible for increased risk of cancer. If you look at prostate cancers, there is a definitive positive association between milk consumption and prostate cancer. Increased risk increased rapidly when increasing milk from just 0 to 100 grams per day. Also, compared to those consuming less than 150 milligrams of calcium from dairy, to those with 600 and more, they had 32% higher risk of prostate cancer. So now a thought may come that is it the calcium that is causing the problem and not the milk? So they did a study to that also. They separated the two and they found that higher intake of dairy foods, but not non-dairy calcium, okay, had a higher risk of prostate cancer. So it is the dairy which is responsible, not calcium. What about breast cancer? Specific dairy foods may contribute to breast cancer risk in women. Higher dairy intake, increased risk of breast, liver, CA, and possibly lymphoma as well. Okay. Another study on ovarian cancer is the galactose. Lactose is basically glucose and galactose. So galactose from lactose found to be toxic to ovarian cells, and they had a 60% more risk with increased consumption of lactose. Right? And low consumption of milk and other dairy products had decreased risk of lung, breast, and ovarian cancers. So all these cancers have been linked to dairy. Okay? But when we come to colorectal cancers, there is a different story. Studies have shown that high consumption of total dairy products and milk was associated with lower risk of colorectal cancers. Ye googly kya ho gaya? Right? So they started to look at the mechanism. What is it? First, they found that a lot of this beneficial effect that you get from curds and yogurt is by the probiotics, okay, not by the dairy. Second, they found that vitamin D, which is included in dairy products, has preventive effect on inflammation related colon cancer. But the biggest thing they said was that the main anti-cancer ingredient in dairy is calcium. Why? Because calcium can bind to intestinal fatty acids and secondary bile acids, thereby reducing their cytotoxicity, and it induces apoptosis in colonic epithelial cells. And epidemiological studies have shown that increased calcium intake can reduce the risk of colorectal cancer, right? But Now what about this other study also showed same thing. Dairy products help protect against colorectal cancer, but they said it is driven largely or wholly by calcium. How did they make this conclusion? Why is it not dairy? Why only calcium? Because they separated the two. They look at the association of cancer separately with dairy only and separately with calcium. And they found that calcium intake was independently associated. Okay? They looked at the source of dietary calcium and it did not matter where the calcium is coming from. The protection is still there. The problem is if you take dairy, then the risk is high. Okay? So, colorectal cancer will give benefit, but that is because of calcium, vitamin D and probiotics for which we don't need dairy again. So, besides causing cancer, it can also be killing us because it increases the cancer mortality also. Not just getting cancer, but people dying of cancer is also high. 43% higher mortality for prostate. If you look for breast, there was a higher incidence. Recurrence rates were 22% higher, cancer mortality 49% higher, and all-cause mortality also 64% higher. A huge study, more than 1 lakh participants with more than 20 years of follow-up showed dose-dependent higher rate of both mortality and fracture in women and mortality in men with milk intake. This is all-cause mortality we are talking of, right? 2 times the risk with more than 3 glasses per day. Even larger study, double the participants with double the follow-up, showed the same thing. Every half additional serving of dairy per day increased mortality risk by 10%. But there are studies which show some benefit of dairy. How do you explain that? Because you have to see it is compared to what. Okay? And if you compare dairy and mortality, you see it is better than consuming eggs and processed meat. They are worse than dairy. It is as bad as consuming meat, fish and poultry, but it is worse than consuming plant foods. What does that mean? If you have a population taking dairy and you compare it with somebody having processed meat and eggs, the dairy people will be doing better. But if you compare dairy with somebody on a plant-based diet, the dairy will be the problematic one. Replacing dairy with plants will reduce the mortality. So what is the role of plant-based diet? Look at this. Somebody having milk less than 1 glass and fruits and veggies more than 5 servings, if they increase their milk intake to 3 glasses or more, the risk goes up by 60% in women and 7% in men. These same people, if they reduce their servings of fruits and vegetables, the risk increases 179% and 31%. So not only is milk causing harm, fruits and vegetables are giving benefits. So both these things we have to understand. So if there is so much of problems with dairy I am going on talking about here, why is nobody speaking about it? Isn't it? It's all about money. Okay? If you look at the industrial influence, US has this RDA, UK has this RDA. Why? It is not because the scientists differ. It is because it is dependent on the political weightage of the dairy industry in that country. The osteoporosis foundations are compromised by the influence of range of commercial sponsors, including dairy products. And Canada dared to change the approach. In their 2019 guidelines, what did they do? They relied on systematic reviews, health, authoritative reports and not industry reports. And what did they conclude? That we need to significantly increase plant-based food intake, limit highly processed food and sugar sweetened beverages. But the most important thing that they did was they removed dairy from their food plate. They said dairy is not a food. You don't need to consume that. Canadian guidelines now no longer say you have to have a glass of milk or whatever. So to conclude, all these reasons that we are giving, honestly, are not scientifically valid also. What is the real reason? We are all addicted. It's very simple. We are all addicted since childhood. We have been taking it, and that is the only reason we continue. We tell ourselves all these things, but that is not the real reason. Because there is one organ that controls our brain, and that is our taste buds. And it is not something, it is scientifically proven again, that casomorphine from casein, which is predominant high in cheese, is what creates this addiction. And that is why even all these fast food restaurants will promote cheese, double cheese, extra cheese, stuffed, whatnot. And look at this, Indian dishes are also not spared now. Wherever you see, you will cheese. But it doesn't need to be that way. We have plant-based milk which are available for display also today. Soy milk, Not only is protective against many cancers, it is improves heart health, easy to digest, and of course environmentally better. We can have many tasty things based on plant-based food also. We could, but many of these are again processed, so you need to have a transition foods. It is best to adapt our taste buds to healthier whole food plant-based options. I asked Chat GPT also, can humans live healthy lives without consuming dairy? Clear evidence-based answer is absolutely yes. Okay? Dairy is not nutritionally essential for humans. Humans can live perfectly healthy, even optimal lives without dairy. It's neither a superfood nor essential. A well-planned dairy-free diet can meet all nutritional needs. Take-home message, milk is not an adult food. It's harmful to planetary health, involves extreme cruelty to cows and buffaloes, doesn't give anything extra that plants can give us, and can be harmful to human health as well. Dairy is not needed. Thank you. Yeah, please.
Dr. Pethe, I have one question.
Yeah.
You being a pediatrician, nowadays, I am also a pediatrician, but the old one. So now it's a new trend that no salt and no sugar, nothing. So does taste doesn't matter to a baby?
My take on that is babies' taste buds are quite naive, and we are the ones which we give the baseline taste to the baby. So I advise below 1 year no salt, and if you want to make it more tasty, instead of salt I advise parents to put a little few drops of lemon juice or a very fine powdered jeera or a dash of pepper. So all this is going to enhance the taste, but without the salt. And all my babies are very happy. None of them take salt till 1 year. After 1 year, half teaspoon sodium chloride, like table salt, in the entire day. So it's obviously less than the adult. But what happens once babies start family pot eating and the entire family itself is having extra salt in the food, then the baby's taste buds are going to reset. So it's important for the entire family to follow that eating pattern.
Rather than the baby, I think it's the family food which matters more.
Yes, and below 1 year no salt, up to 2 years I advise no sugar or even jaggery. And I ask them to sweeten whatever foods. Not every food needs to be sweet, but the sweet foods can be sweetened with date paste or raisin paste, or even dry figs can be soaked and made a paste of and can be used as a sweetener. So again, why these ultra processed foods are addictive? Because they are hyper palatable. So kids, the growing taste buds are more addictive to these. Even adults get addicted. So when we avoid the ultra processed foods and even these processed sugar, salt and jaggery, and stick to natural foods, the taste buds are much more likely to enjoy the whole foods, is my experience.
My question is any studies on plant-based diet on autistic kids or autism? And the second question is for the chronic pain syndromes, like kind of fibromyalgia. So any studies or any personal experiences?
So yes, there are studies, as well as we have personally also found a lot of improvement. Autistic kids do very well on a whole food plant-based. So the whole part is very important. Just plant-based, but with a lot of transition foods, a lot of processed plant-based cheese, and all those things are not going to work. But again, the process has to happen slowly, because in autism, the family is anyway stressed. So how we approach it and how we counsel the family to slowly transition, not just the child, but the family's eating pattern, that way. But autistic kids do very well on whole food plant-based. The hyperactivity component also improves substantially. They respond better to therapy. And also for chronic pain conditions, fibromyalgias, and anything with a chronic inflammatory process going on in the body, these patients also do very well on a plant-based, whole food plant-based diet. We see...
Let me take that. Yeah. I have points for both of them because I have patients for both of them. In autism, I have worked with at least 4 kids. So autism, if you want to search, you search GFCF diet.
that is gluten-free, casein-free. I mentioned it in my talk about that kid. So we have to understand that 40% of the autistic kids have gastrointestinal disturbances, and that is to do with their gut microbiome, dysbiosis. So the dysbiosis is because of lack of fiber that can come with the animal foods, the dairy, as well as through the processed foods. So, and because nowadays the gluten is also genetically modified, from the long grain of wheat we have shifted to the durum wheat, the gluten also has become pro-inflammatory. So they become very good with that. Now what happens is when their stomach aches decrease, now they are very young initially to understand why they are cranky, why they are crying, because यहाँ वो कहते हैं पैर में मरोड़ पड़ते हैं. So with the improving of the gut bacteria, their gastrointestinal disturbances decrease, they become less cranky. So with that, the developmental therapy that is done to them, they become more receptive to it. The second very important thing, not only about autistic kids and also with the ADHD kids, is that they love nature. Now I'll give you an example of a small kid. They're twins. One of them was borderline autism, the other was not. Around 2.5 years of age, we took them to a farm called as Hideout Farm in Palghar. And there all the food that was a natural food, farm to home distance 0. And that kid was, the parents said, as usual we adults don't understand too much. They said, "Aaj bina TV dekhe so gaye. It's okay, kuch nahi tha." But then the next week, the father called my husband, who the colleagues, right? He said, for the first time in his life, my son, the autistic one, spoke with purpose, with meaning. जो इतना महीनों का developmental therapy में नहीं हुआ था. Secondly, for the first time, he drove a bicycle without getting afraid. That was the amount of difference one night of a farm trip, being in nature, in the healthy whole plants, वही खिला रहे थे हम लोग, and being that worked on him. The other kid is a very rare syndrome of autism, where the mother took it on herself that she will make him one of the best kid, functionally kid, because उसको पता है वो Down syndrome जैसा है, he will never be able to get that life. But believe me, now she's driving the change around the world, teaching all other parents about the GFCF. In fibromyalgia, besides the diet, I also want to talk about two things. Fibromyalgic people, a lot of them go to the rheumatologists. So because rheumatology and dermatology go together, so this is again an autoimmune condition. So your leaky gut syndrome has an impact on it. So fiber, gut health works with the whole plant-based. Secondly, fibromyalgia also has an emotional component to it. So we have to delve deeper into what is causing it. Sometimes it's the inner child hurting and everything, and that really works in all of my patients. One of them was really hurt with the fibromyalgia case had come, and they have had a very bad case from the beginning with one divorce and other abusive marriage and everything. I had to work on that, and her fibromyalgia came down.
Firstly, I want to congratulate all the speakers for an excellent session. And my question one is, because dairy is out, so about the plant-based milks, how will you rate them vis-a-vis the almond milk, the oat milk, and the soy milk? How will you rate them in terms of their fatty acids and their caloric value and their carbohydrate load? Because when I am suggesting these milks to my patient, then I'm also worried subconsciously about the fats in them. So I want to know how will you rate these milks in these terms, okay? And secondly, to you, Dr. Smriti, if we are to cut out the animal proteins, then which are the most dense vegetarian proteins which I can suggest to my patients? Because then that becomes the crux of the plant-based diet. We are very happy to prescribe a plant-based diet any day. But the protein derivation from the plant-based, the best bioassimilation, bioavailability, which would you suggest in a plant-based diet? The best proteins. I am an obesity consultant, a scope certified obesity consultant, actually an anesthetist, but now practicing as an obesity consultant. So these, as an MD doctor, these are my concerns.
So first you talked about alternative milks. So I'll go back to what I said at the start. See, milk is a food for the infant. Okay. The reason we are looking at plant-based milks also is because we are addicted to dairy milk. And that is the only reason we are looking for supplements and alternatives.
You know, I have a friend who carries a almond milk around for a coffee. When we have a friend get together, she'll come with her carton of almond milk for her coffee. So I agree, it's an addiction. But then the patients come to me, I immediately can't take them off.
Yeah, that's understood. I'm just saying that we should be aware of this. That is the first thing, right? Now
What is the next best alternative which I can give them then?
In one word, it's soy milk. Soy milk is the best in all forms of thing, because there's a lot of phytoestrogens and which are a lot of benefits in the body, reduces lot of risks, especially for cancers and other things. It is also environmentally the best thing, and it is the closest if you are talking of proteins or whatever you want to look at as far as dairy is concerned. So any soy milk and soy milk based derivatives like tofu you have and a lot of things that are there, all these things will be beneficial. Right? That's the simple thing. But for taste, many people may have, some may have oats, some may have almonds or whatever. That is the thing. And proteins, yeah, so proteins actually it's a little complicated. I have a 40-minute talk on that, because proteins, there are a lot of misconceptions out there. Right from how much proteins do we need? That is where the whole problem comes. And carbs have been given a very bad name, unfortunately, because we are over consuming refined carbs, which are bad. But when you say carbs are bad, even the complex carbs are getting a bad name, which is wrong. We require, yeah, and the complex carbs, they give us fiber, and that is extremely important. So if you look at what is known as a protein energy ratio, PER, okay, that is how much percentage of calories are coming from protein in that particular product. You will see that something like broccoli will give you more proteins than beef. Okay, spinach will give you more proteins than say chicken or eggs, right? But the reason is that they are calorically dense, these animal foods. So you can get lot of things in a very small package, but you get lot of bad things also along with that. So that is the, so if you stick to a whole food plant-based diet, okay, which I have been doing for past, okay, whole foods I have been past for 8-10 months now, but plant-based since past 6 years now, okay, I think I'm doing all right, okay. So if you are worried about fitness and health, and people tend to think that you have to consume proteins to become strong, you have to exercise to become strong, okay. Eating proteins is not the requirement. Once you exercise, your food intake will increase. Every food has proteins in it, right? So we should come out of this protein carb thing. You have to look at the broader picture. You have to look at whole foods. You have to look at plant-based. On a plant-based diet, I assure you, you will get enough proteins.
I'll just...
Sorry. Can you please also answer the MUFA and PUFA conundrum? What should be the balance between these two, between omega-3, omega-6 and all? Can you please address that also?
See, so fatty acids, there are different types. Yeah, you have saturated, unsaturated. Unsaturated, you have MUFA and PUFA, right? In PUFA, you have omega-3 and omega-6. Right? So, omega-3, there are a lot of studies which have shown benefits. Okay, omega-6 is also important, but the problem is because we are consuming a lot of refined oils, refined vegetable oils, the omega-6 ratio has gone up radically. Ideally, it should be 1:1. Now, in Indians, in urban, it is almost 39:1. Whole seeds, omega-6 is. No, seeds like flax seeds, chia seeds are excellent sources of omega-3, which is what we want. Okay, so omega-3 intake has to increase, omega-6 has to reduce. Omega-6 comes from refined oils. So oil consumption has to be reduced or eliminated. Oil is not needed. You have natural fats from natural whole foods, those you can consume. And Dr. Mrudula is going to show us how to do oil-free cooking. Okay, so that is what we should look at. And
So I will just add 2 or 3 points. Number one, all of your questions are valid, and that's why I want you all to make a note of 24th of August, Sunday. We are coming with a full day CME in Tip Top Plaza. in collaboration with IMA Mulund on the Sunday of the 24th August. So in that, Dr. Sharang will take that topic, and we will be dealing with the whole of the protein as well as all these trace elements and the micronutrients. Coming to the practical aspect of telling the patients, because I am following the lifestyle integrating into dermatology. First of all, when you in the nuts and seeds, we have to understand that has to be limited. पेशेंट्स को समझाने के लिए बोलो कि एक आलमंड और एक वॉलनट भी एक ढक्कन में आता है, तो हम नेचर भी नहीं चाहती कि आप उसको भर भर के खाओ. वी वांट 50% ऑफ द प्लेट एज शी शोन फ्रूट्स एंड वेजिटेबल्स, 25% ग्रेन्स, और जो 25 का प्रोटीन था ना, उसमें अगर आप ICMR की प्लेट देखोगे उसमें थोड़ा सा नट्स एंड सीड्स है. इफ यू टेक 1 टीस्पून सनफ्लावर सीड्स, 1 टीस्पून पंपकिन सीड्स, 2 टीस्पून फ्लैक्स सीड्स, 5 almonds and 5 walnut halves, omega-3 omega-6 fatty acids का perfect ratio मिल जाएगा. We need omega-6 lesser, but we need it. So this is a combination perfect. Secondly, in the WhatsApp group, we will share our diet. I have made it, we both did an exercise on how much protein we are getting in our daily thing. I was easily getting 70-80 gram on a routine day to 110 grams also. And you will see it was just in my plates of rajma, chole, kale chane, beans. Just imagination में every plate had to have protein. अभी पोहा है तो उसमें peanuts डाल दो. राजमा है, मतलब सब्जी और रोटी ही मत खाओ, दाल भी डालो. You know, with that, just to include protein in every meal, and it was just sorted by not adding a single protein powder. And we are working out 4 or 5 to 6 days in a week with strength training, cardio and everything. Our bodies are not only allowing us, we are actually feeling fitter and better than when we were not plant-based.
I would, in the interest of time, as she mentioned, on 24th of August, we do have a full day CME on.
How to get the chemical from the plant? How to
we'll address all these in 24th August. In short, you have to take supplements. For now, that's the simple answer. Why we have to take supplements is a long, elaborate explanation, which maybe over the food snacks, I will explain it to you personally.
I'll give you 1 second. The B12 is created by soil. Right now, soil bacteria is depleted. The study was done by Dr. Sanjeev Khanna. Vegetarians and non-vegetarians are equally deficient in vitamin B12. Statistically, no significant difference.
So thank you so much, all three of you all. It was a pleasure, and I'm sure this was just a starter. Abhi full meal baki hai, 24th of August. What we have done today is not just theory. So I'm sure whoever enrolled had already had some sort of inclining towards how do we do this in our lives. But there were a lot of challenges which we face. How do we find dairy alternative? How do we find protein alternative? So today, to some, in a very small, concise manner, we have also added cooking demo, and we also have a table for nut milk. So we have put, Swati, we have put the calorie, the protein and the fat percentage of all the 4 milks, and there is tasting also of the milk, also how to make the milk. So we would love that each of you all should attempt and take baby steps towards, you know, substituting your current, whatever you have found out of all these 3 lectures, that what is that you can change or substitute with one of the plant-based items. And I think that is the way each of us has started our journey for so long. And it is not that in one day you will be able to clean up your kitchens and, you know, change completely to whole food plant-based. It's a journey which has to begin today. At that note, I would also want to tell you that we served you mango milkshake, right? Each of you all had? Yes? Did you all enjoy it? Yeah. Yes? Can anybody guess what was the milk component of? Yes, it was coconut milk. And what about the sweetness? It was dates. So we have got food for you. It's not much, but it will definitely show you what are the alternatives of dairy. Yes. So we will be serving you as you are watching Mrudula prepare the food. We'll be serving you at your place only. We have got the paneer alternative, that is tofu with vegetables. It is marinated in peanut curd. We have dahi vada, which is steamed vadas of moong dal and urad combination in again peanut curd. So that is the food. And to sum it up, dessert is ice cream and in almond milk, with dates as sweetener. So we have tried to get all types of milk for you to taste in actually cooked format, and of course taste the milk as virgin milk, like how directly. So you can visit this table, understand the milk components post Mrudula session. So please enjoy. Mrudula, please. Okay.
Good evening everyone. Am I audible? Yeah. So welcome to this session 2. So आपलं theory झालं first year, second year, third year MBBS, and now actually the internship मध्ये practical गोष्टी काय करतात ते आता बघायला लागतं. Because we all learn a lot of things, but how to apply, how to make use of that in our own kitchens is a challenge. So today our food has been influenced largely by a lot of marketing that goes on, a lot of labels from the Western culture. But very frankly, food need not be complicated, it need not be westernized, it can be made fresh from wholesome ingredients, plant-based ingredients which are locally available. And today we will prepare a meal which is no oil food cooking from locally available ingredients, and let's begin. So to start with, I have already put some water to boil, and I have some spinach here, and I'll just put the spinach in water to blanch. Okay, and what I'm going to do is, along with this, I have a sieve here. So since we are time bound, I'm going to use the same fire to steam the vegetables in the same go. So एक चाळणी आहे ही, ह्याच्यामध्ये I'm going to add some green peas, carrot and some corn. Okay, and I will steam it simultaneously so we save time. So this happens together. Okay, now while this is done, today's menu is a brown rice pulao. Along with that, I am going to make some vegetable palak raita. I am going to demonstrate one dip and one dressing. Okay, so this is done. Why steaming? Okay, when we cook, there are a lot of processes involved. Most of the times we use boiling. आपण corn घेतो, पाण्यात टाकतो, शिजवतो, and then we drain off that water and we use the corn. So we are losing out on nutrients. So steaming is a much better process of cooking. It retains nutrients much better than boiling, in which we lose out on the nutrients. Baking is also good, roasting is good, but steaming is better in terms of retaining the moisture. It locks in the nutrients and is better for absorption. So unlike roasting, especially in whole food plant-based cooking, where you want to avoid oil, you want to retain the moisture of the nutrients, because otherwise the dry झालं. आता टिक्की आपण बनवतो, air fryer मध्ये बनवतो. Why is it not acceptable? Because it becomes very dry, because there is no oil in it. Now to maintain the moisture, what we need to do is retain it by steaming. So that is pro tip number 1, is we will steam the vegetables. Second, what we are going to cook today is a brown rice pulao, for which I have used this brown rice, which I had soaked in the morning for 2 hours, and then for ease of demonstration, I have parboiled it to almost al dente. Al dente is almost done. Okay. So why soaking? Soaking is very important because, again, nutritionally beneficial. Not only it reduces your cooking time, but it also decreases the phytic acids, which is an anti-nutrient. So your zinc and calcium absorption will get better if you have soaked your cereals, your legumes and your pulses. Okay, so इथे हे steam करायला लावलेलं आहे मी, and I have used this brown rice which I have parboiled today, and along with this what I am going to use is tofu, some green peas and cashew nuts. So while our vegetables are steamed, our palak need not be completely cooked. It just needs to be a little blanched. So I'll take it off and can continue the cooking with this. The moment we remove the palak, I will be putting a little cold water on that. We want the palak to be blanched and not cooked completely. So the palak is blanched. And this much of blanching is enough, just that it changes its color. Okay. And after it cools down, I am going to add a little lime to it. Let's cover it and keep this. Now in the same water, I am going to add some dry whole spices. हे पालकाचंच पाणी आपण वापरतो आहे. I am going to add one tejpatta, one masala ilaichi. This is lemongrass, some cloves, dalchini, and some peppercorns. Now whenever you want to recreate a recipe and make it more healthy, whether you want to make a veganized version of a non-vegan dish or you want to make a healthier version of a conventional dish, it is very important that the dish tastes the same as your original and the texture is also the same as the original. Now whenever you are not going to use any oil for the dish to taste better, we have to make use of fresh herbs. So if you are using pulavs, if you are making an Indian dish, you can opt for tejpatta or your masalas. If you are making Thai, you can use lemongrass. If you are making a Mexican rice or an Italian cuisine, you can make use of basil or thyme or rosemary and such fresh herbs. Now they are easily available with Nature's Basket, you can use them. So let the vegetables steam further. So the water is boiled and in the same water I am going to be adding almost done brown rice. Okay. And why have I used brown rice? Brown rice is, we know, has its ban and is a more polar form than its white counterpart. It has more fiber, so it gives a better satiety feeling and keeps you fuller for longer time. Okay. So once the vegetables have begun to steam, I am going to add the brown rice to this. And let it cook further. And there is still some moisture, so hey, this will also happen together. Okay, so the brown rice is almost done, and while this is being, I will shift this to the sim. And what we are going to start preparing here is some roasting. For this I have a little jali here which I am going to place on this tawa, and what I have here is a red bell pepper, I have a tomato, I have an onion, so we will just roast it with the knife. Okay. And while this is roasted, I luckily have a roasted onion with me. Similarly, what we are going to roast is some garlic pods, and I had roasted one onion just to save time. Okay. So we will roast the bell peppers and the tomato. Simultaneously the rice is being cooked. Now what we are going to make is a dip and a dressing, okay, and a palak raita. Now when we talk about being vegan, the commonest question that people ask is, how do I complete my protein requirements? Now it is very easy to complete your protein requirements, as Dr. Smriti said, from a vegetarian meal. There is ample proteins in the vegetarian meal. What we need to do is just understand where to use it. Okay. So bell pepper hardly takes any time. The moment it gets charred, I am going to put the tomato. Now for today, along with the brown rice, I am using tofu, and I am going to be using peas. Peas along with the natural proteins also has folate. Tofu again has got lot of essential amino acids. instead of this, what could you use? Instead of the brown rice, you could use jowar, which is soaked and pressure cooked. It may take about 7 to 8 whistles. You could use rajgira, or you could use any millet. You could use barnyard millet, apla wari, or you could use little millet. Little millet for rice based preparations goes pretty well. So we could use little millet for the pulao, or you could use quinoa. Along with that, you could use soy chunks, soya nuggets for proteins, or you could use a simple thing as green peas. I said you could use broccoli, or you could make it fancy by using edamame beans with quinoa and pecan beans and give it some fancy name. Just like our own harditsa doodh has become turmeric latte, our own ambir has become kombucha, and our own jackfruit has become veganized meat. So we need not go to a store and all our ingredients are available. See, what we need to remember is the more local food that you purchase, the better the nutrients. The time between the harvest and consumption, हे जेवढा कमी असेल तेवढे तुमचे न्यूट्रिएंट्स जास्त असणार. जेवढा टाइम कमी तेवढं त्या खाद्याला प्रिझर्वेटिव्स कमी लागणार, तेवढा त्याचा स्टोरेज कमी राहणार, तेवढं त्याची ट्रान्सपोर्ट कॉस्ट कमी होणार, and the carbon footprint also decreases. So go for locally available foods rather than going for something fancier. So my take would be choose futane or sattu over protein powders. Choose rajgira or millets over quinoa. Choose jackfruit over veganized meat. Choose simple jaggery, although it is processed, over maple syrup, because maple syrup is further processed and by the time it reaches here, it also has preservatives in it. Okay, so that was about it. In the meanwhile, since the vegetables are almost done, and I'll switch this off, the rice is also almost done. And what we will do now is, this is the palak that we had blanched. ह्याच्यावर मी काय करणार आहे, ह्याच्यावर मी पहिलं तर एक थोडं लिंबाचा रस टाकणार आहे. I'm going to squeeze a little lime juice on the palak. Why? पोहे खातो आपण. When we serve pohe or whatever upma, whenever we serve in our conventional cooking, we serve the plate, we garnish it with coriander and we give a lime cup piece at the side. Why? Because coriander is green, it has iron, and you don't want, the lime is vitamin C, which is heat labile. So you don't want the vitamin C to lose its efficacy because of the heat. आणि ते टेम्परेचर थोडं कमी करण्यासाठी आपण लिंबू वेगळं देतो आणि कोथिंबीर वरनं टाकतो, and it is not mixed and fried together. So any greens, iron absorption is going to be increased if you add vitamin C or lime. So म्हणून पालकावरती थोडंसं मी लिंबू पिळून ठेवलंय गार झाल्यानंतर. To cool it further, you can add cold water. That will retain the color and it will prevent further cooking. So excessive cooking होणार नाही. I've had cold water with me, but it was not completely cooked, so I just kept it covered for some time. Okay. In the meanwhile, what we are going to do is, so we will quickly make the masala for this. For this, I am going to take some peeled garlic from this. Along with that, I am going to add coriander, some mint leaves. When we roast this, it releases some essential oils. So हे जेव्हा सुक्क असतं ना त्याच्यातला ओलसरपणा नाही आहे. The moment you roast it, it releases its essential oils, and in no oil cooking, that's a trick. जसं आपण शेंगदाणे भाजतो, and when we शेंगदाण्याची चटणी when we run it in the mixer, the chutney is very dry. Okay, पण तुम्ही ती कुटून जर केली तर त्याला तेल सुटतं. So that is a natural oil that is being released when you use the mottle and pastel. So I got a mottle and pastel, but since we are time bound, I am going to use the mixie now, and I am going to use a little garlic. Along with this, I am going to add pudina, some coriander, along with the stems. Deta sakad घ्यायचं नेहमी. Okay, juice of lime, and I am going to add to this is rock salt. Rock salt is the unprocessed form, whole salt. And I am going to add a little water to this, very little, and then grind it into a fine paste. I will also add a small piece of ginger. Okay. Okay. And while this we are what I am going to do is I am going to put my cashews for roasting. Okay. So ते स्लोवर होत राहील तोपर्यंत आपण ह्याचं नंतर. So I've got a mixer here on it. So ज्या वेळेला आपण dry roast करताना, if you are using tofu, if you directly put it on the pan, ते करपतं because we are not going to use any oil. Okay. So what I am going to do here is I have this banana leaf with me, आणि इथे मी काय करणार आहे, I am going to put the tofu piece here. त्याला आपण स्लाइड थोडेसे कट्स देऊया. And then I am going to add the marinade, whatever masala which we have made, over it. Okay, and now what we will do is we will just pack this, and I will fix it up with a some trick. Very good. So I'll just fix it with a long so that your packet doesn't come off. आणि हे काजू इथे roast होता है. The moment it is roasted, I'll take this off. And then we will place our tofu to get heated. So banana leaves आपण जे essential oil आहे, that is going to get released, and your masala is going to be the tofu is going to absorb that. So instead of using oil, I am making use of the banana leaf to sear the tofu. Okay, we can use it from both the sides. हाँ gas थोड़ा slow है, but it will happen. Okay. Meanwhile, our rice is almost done. And it's just time now to assemble everything. हे आपण काढून टाकू शकतो त्या पेपर बॅग मध्ये टाक. Okay. So just a matter of time now. Our masala is ready. I'm going to add the masala to the rice. There is no need for oil. Flavors are going to come from the masala that we have added. थोड़ा कमी है, मी घरनं थोड़ा करून आणला होता already. So I'm going to add that. Meanwhile, the tofu has to be just stirred a little bit. थोडं पाणी घालून दे ना याच्यात. याच्यात पण घे. Okay. Our carrot and peas were already steamed. We'll add that. I'm going to keep the corn for the raita. Give it a good toss. And here I'm going to use normal salt. Why I'm going to use normal salt in this, and why did I use rock salt in the salad? Government of India introduced the iodine deficiency program by introducing iodinized namak. So if this is where I feel that we need to be wise to be choosing what we are doing, and to not get carried away by just some influence that is coming in. Okay, choose wisely. If I am going to use rock salt in the salad, I will use iodized namak in my food. If I am going to use pea curd for something, I am going to use coconut curd for something else. I am going to use almond milk for something else. So meal rotation is very important. So हे सगळं आपण आता mix करूया. And then we will add some cashews to it. How many of you all can tell that the salt is correct by the smell of it? By the smell of it. So मिठाचा वास येतो. I don't know if you all have noticed it, but you can actually make out that there is no salt in it just by the smell. Okay, so the rice is almost done, and I'll take it on this and त्याला एक steam येऊ दे. Okay, in the meanwhile आपल्याला so this extra liquid is there, थोडंसं steam होऊ दे त्याला. On the slow flame. Meanwhile, let's make a marinade. Let's make the dip. For the dip, what we had used is the roasted bell pepper, some onion. त्याच्यामध्ये कांदा घालायचा विसरले मी. It's a little undone, so I'll make it into smaller chunks. Along with this, I will add some cashews to give it a little texture. I'm going to add rock salt. And I'm going to add some spice to it. Chili flakes. So dips are very important, especially in whole food cooking, because the food turns out to be a little dry. ह्याच्यात तेल नहीं है. So along with that, if you give a little gravy based thing, or if you're serving a tikki, you give a dip with it, or you give a yogurt, a pea based yogurt along with the tikki, then the palatability increases. Okay, so I'm going to add a little chili flakes to this, cashew. आणि मग आपण हे ह्याला ग्राइंड करूया. So dip is also almost ready, and coming to the last part is assembling the raita. याला बाजूला करा आता, झाकण काढून ते मॅरिनेट करायचं आहे त्याच्यासाठी. Now let's assemble the raita. रायता साठी आपण ह्याला थोडंसं हे याच्यात काढ. So I have here coconut milk based yogurt which we have made at home. Coconut milk ला स्टार्टर लावायचं आणि देन दही जमवतो तसं दही जमवतो आपण. याचं मिरचीचं देठ मिरचीचं देठ विरजण्यासाठी आपण मिरचीचं देठ लावू शकतो. देठ द स्टॉक एनी हां आणि जस्ट वॉर्म मिल्क आपण विरजण जसं लावतो त्याच्याऐवजी. अँड नाव द पालक आहे इथे, ह्याला मी थोडा चॉप करते. सॉरी कुठे गेली. So tip number 4 was whenever you are adding greens, you add lime to that. And why have I chosen coconut milk here today is that coconut milk has the least amount of calcium. Now iron based preparations are the absorption is decreased because of use of calcium. Okay, we have learnt it and then forgotten. So coconut milk has the least amount of calcium, and that's the reason I am using coconut milk. Again I am going to use rock salt and I am going to use bhuna jeera powder into this just for garnishing it. Along with this some roasted shengdane I have, which I will add for the crunch. And of course आपले corn मगाशी जे आपण steam करून ठेवले होते, because we are not using sugar in the raita. You need a natural sweetness, so the corn will give some natural sweetness to this. If you want, you can add coriander also. I need to taste this. So dahi is out of the fridge since 1 o'clock, so it's become a little khatta, but otherwise good. So the raita is ready. And last what I want to demonstrate is the marinade. Rice is also almost done. We'll just so हे garlic cloves पण एक छान वास येतो त्या टोफूला आणि then we can cut the pieces and add it. I think that should be enough for that much rice. And then give it a good red color. Like all the mothers do. ओके गाजर थोडं शिजायला हवं होतं बट ओके. ड्रेसिंगमध्ये चॅलेंज काय येतो की आपल्याला शुगर वापरायची नाही आहे आणि ऑइल पण वापरायचं नाही आहे. नाव फॉर अ ड्रेसिंग वी नीड एक गोड गोष्ट, एक तिखट गोष्ट, एक आंबट गोष्ट, and in the salad we need a fat and a protein to make a salad complete. Okay, so ड्रेसिंग मध्ये आपण जनरली फॅट साठी काय वापरतो, ऑलिव्ह ऑइल वापरतो, but we are not going to make any use of any oil to make the marinade to make the dressing a little runny so that ते salad वरती चांगलं पसरेल म्हणून. Today we are not going to use oil, we are not going to use sugar, because the whole purpose of the whole food is getting dissolved because of that. Then what to do? Any ideas? हे धुतलंस? Perfect. So what I am going to do is, I have one small piece of papaya here, I have a small piece of mango which I will chop. So this will give the natural sweetness. Okay, one small piece of mango. Totapuri amba hai, so any tangy fruit is good. ह्याच्यामध्ये you can add a little orange juice, that will make the texture more runny, so ते salad ला सगळीकडे mix पण होतं. I'm going to add a little orange juice to this, and then your salt and chili as per taste. Walnut salad मध्ये आपण घालू शकतो to increase the fat if you want it in that. So little chili flakes in this, and salt. So there we go. सो आता माझ्याकडे हे थोडेसे कॉर्न उरले, थोडं कॅरेट उरलंय, थोडं ग्रीन पीस उरलंय, देन हे थोडे रोस्टेड बेल पेपर्स उरलेत, some onion is left which I will chop into smaller pieces, that papaya is left, that small piece of mango is also left. So जे काही उरलेलं आहे, काकडी आहे, काकडी आपण रायत्यामध्ये पण थोडी टाकू शकतो, just to give a more crunchier feel. Then I have some kakdi here. This by the way is a dabba which I got from Amazon, which is so useful. रात्रीचं सगळं preparation ह्याच्यामध्ये करून you can stack one above the other in the fridge. And a little bit of coriander. ते फोटो मध्ये सगळं असं कचरा येणार आहे. Okay. And plus we will add the tomatoes. They are not completely done, but for salad they will be fine. The remaining roasted peppers, हे पण जाईल ह्याच्यामध्ये. This is my makeshift basin which I made. And now we will add the marinade. Colorful, nutritious, and balanced. Interestingly, our culture teaches us to be balanced. I don't know if you all have ever thought about it. Hinduism मध्ये वर्षाचे 30 ते 40 उपास असतात. आषाढी एकादशी, सगळ्या महाशिवरात्र, संकष्ट्या, नवरात्र. मुस्लिम्स मध्ये 30 days of रोजा. Christianity मध्ये 30 days of Lent, where they ask you to refrain from indulgences, to refrain from, it's a period of abstinence. So culturally we are asked to be balanced. Shravan apan palto is a way to reboot our system, to detox our system, to detox the ecosystem. As if you have heard the story about the snakes which were killed out of fear, then the population of the frogs increased. Because the population of the frogs increased, the pests were killed. Because the insects were killed, the birds did not come to the fields. Because the birds did not come to the fields, the pests overran the fields. One link in the ecosystem can derail the entire ecology. So our culture teaches us to be balanced in thought, in our work, in our mind, and to connect to our own self. So our salad is ready. आपण एक marinade पण serve करूया. Sorry, the dip, not the. Garnish it with some mint leaves. There you go. That's your third item. And rice आपण याच्यात काढू. We can add the tofu also to the salad. हे पण उरलंय. And you can order it online. चेत्रांसचं चांगलं असतं. चेत्रांस. Nature basket मध्ये चेत्रांस मिळतं.
So there are a lot of options there. Chetrans is a Pune-based company which makes excellent soy-based products आणि extremely cheap. Okay, म्हणजे normally कसं if you buy soy milk 150 रुपये लिटर वगैरे तर ते it becomes a little forbidding for many people. बट चेत्रांचं एकदम रिझनेबलमध्ये असतं. असं 20 रुपये 30 रुपये वगैरे काचेच्या बॉटलमधनं सॉय मिल्क देतात. दे गिव्ह सॉय कर्ड एक्सलंट. आय विल सेंड सर्टन.
Correct.
Absolutely.
That's where I said is where we need to be sensible and wise enough to choose. In the zest to become a whole food or veganize. अपन जर processed cheese खातोय, processed almond milk खातोय, then it is actually not serving the purpose. But there is a transition. There is a journey that you need to attain, and to reach there, these are stepping stones.
No, one minute. There is a difference. One is there is processed vegan food. Okay, म्हणजे तुम्ही रेस्टॉरंटमध्ये गेला तुम्हाला एक vegan pizza मिळेल. Okay, which will have vegan cheese and vegan butter and everything is available. That is not good for health. Okay, ते चवीसाठी लोक खात आहेत. Okay, so we are not talking of that. Vegan curd जर बघितलं, soy based curd which I am saying, health wise it is excellent. There is no problem. There are no preservatives, there are no additives, nothing is there in that. Okay, Tetra Pak is an issue. Yes, environmentally it is not the right thing. But health wise there is no problem. Even if you want to have soy milk, suppose, okay, you will get flavored from a Tetra Pak. Suppose you will have flavored soy milks which will have sugar added in it, flavors and whatnot, and you will have unflavored. So unflavored je hai, health wise it is fine.
Much better.
Okay, but again it will come in a Tetra Pak or some plastic container. That problem is there. So the alternative is we have kept here. You can see later on. It's a nut milk maker. So I have this at home. Lata has this at home. Every day we make warm, nice soy milk. You can make almond milk. You can make oat milk. Whatever you want, you can make in this. Garcha gari ready made. You can just pour it in your glass and have it. So then you have to take a little more efforts. त्याचंच तुम्ही दही बनवू शकता. That option is also there.
Unless you take efforts, it's not going to work.
You have to just put a starter. Normal curd जसं बनवतो ना तसंच. हां, मिरचीचे तुकडे. The date.